For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning. Thank you for being here this morning. My name is Hillary Armstrong, and I'm a Public Information Officer with the County of Santa Clara. Today, we are here to share with you the county's new vaccination clinic that is launching today for the staff of skilled nursing facilities. We will have Dr. Sarah Cody, Public Health Officer and Director of Public Health, Dr. Marty Fenstersheim, COVID-19 Testing and Vaccine Officer, President Cindy Chavez from the Board of Supervisors of the County of Santa Clara, and Supervisor Otto Lee from the Board of Supervisors of the County of Santa Clara. After the press conference concludes in English, we will have Dr. Elsa Villarino, Assistant Health Officer, providing remarks and answering questions in Spanish, and then have representatives from other languages recording their remarks. With that, I will hand it over to Dr. Sarah Cody. Thank you.
Good morning, everyone, and thank you as always for being here. Welcome to the fairgrounds, where we are beginning today, beginning our COVID-19 vaccination program. So we have come a long way in fighting this virus, as we have been fighting since late January. And certainly this third surge has challenged us in a way that the previous two surges did not. We are now seeing an average of over 1,000 cases per day. We have passed the 52,000 mark. 52,000 residents of our county have been diagnosed with COVID-19. And as of today, 566 of our fellow county residents have died of COVID, and the same number, 566, are currently hospitalized with COVID in our county. Our ICU beds are dwindling. But today, even as this crisis accelerates, at last we have a ray of hope as we are starting to vaccinate. The vaccine just arrived in our county earlier this week. So we cannot normalize the devastation that is around us, but we can have hope and see a path forward in getting ourselves out of this current crisis and seeing that this pandemic will not last forever. So today is a first step, and my colleague and longtime friend, Dr. Marty Fenstersheim, will tell you a little bit more about this. But I want to leave you with a couple things. So even as we have this hope and we begin to vaccinate, we have to still continue all of the other efforts that we have been practicing. We must continue to wear our masks. We must continue to stay home as much as possible. We must continue to not gather. We have to have all of this in place until we get our vaccination rates very high. So it's going to be a difficult several months in front of us, but we can march forward with hope. I look forward to the day when I can too be vaccinated. I am delighted to know that one day I too will be vaccinated. It's not yet my turn. We are going in the order that our colleagues at the state and federal level have outlined for us. So I would like to introduce Dr. Fenstersheim, and before I do, I just want to say that many years ago, during the H1N1 pandemic, Dr. Fenstersheim and I were right here at Expo Hall doing vaccinations. So it's particularly lovely to be here with you, Marty. So thank you.
Good morning, everyone. And thank you, Dr. Cody. I too remember in 2009 when we were standing here getting ready to give our first vaccine doses of H1N1. Again, it was a welcome relief after that pandemic. And now today we are very, very excited to be holding the first vaccine clinic for the COVID-19 vaccine that arrived in our county this week. So today we will be vaccinating around 210 people, and these people are workers, they are staff at various skilled nursing facilities in our county. They are in the high priority group, which has been prioritized for early vaccinations. And we feel that they represent, again, a staff that's working in one of the most important areas to protect in our community, and that's the skilled nursing facilities. The residents in the skilled nursing facilities, their cases represent 5% of all of our cases, but they represent 45% of the deaths. So we want to vaccinate and protect those residents, and by doing the staff first, that will protect the residents who will eventually get vaccinated. So today we're starting with the skilled nursing facilities. This is the public health department doing this vaccine today. Later on this week and into the weekend, all of the hospitals will be receiving their vaccine, their first shipment of the Pfizer vaccine. And so we should see vaccinations across the county again in the highest priority group, which was approved by the federal government, which is the healthcare workers and also residents in the skilled nursing and long-term care facilities. So we expect to do hopefully around 6,000 vaccinations over the course of the next few weeks, and most likely scaling up our operation here. We've started a little slow because we need to get used to the procedure with this new vaccine. So we're very, very excited. This is certainly a bright light at the end of a very dark tunnel. And the comments that I've made before about making sure that people are vigilant, we have our masks on today, and we'll continue to wear our masks and stay socially distanced for the next several months until we can vaccinate enough people in our community and the country to finally be able to take off our masks and move forward in a more normal community. It's going to take at least 70 to 80% of our community to be vaccinated, and that will take several months into the future. But I think if we're all patient and take our turns and wait patiently for the vaccine, it will arrive, and we will all hopefully see the end of this over the next several months. I too will be vaccinated at some point when it's my turn. And again, the priorities are given to us by the federal government. In fact, today, the FDA will be meeting with the Moderna group, and hopefully they will approve the next vaccine that we should be seeing arriving in our community next week. The CDC's committee will be meeting again over the weekend to give us the next level of prioritization so that we can begin planning to begin vaccinating more members of our community. So again, I want to remind the community this is just the beginning, and hopefully the beginning of the end of this pandemic, but we still have to maintain our vigilance. As Dr. Cody said, there are a lot of people that are in the hospital, a lot of people have died, and we don't want to see any more of that. And so we need to stay home for the holidays and take care of each other. And hopefully, again, in the next several months, we will be able to celebrate a little bit more. So thank you, and I want to introduce President of the Board of Supervisors, Cindy Chavez. Oh, I'm sorry.
No, you did great. I didn't know who the last person was. Well, good morning, everyone. And I just wanted to say a couple of obvious things. One is that I know everybody is really tired. Our businesses are tired, our communities are tired, our teachers are tired, our parents who are teaching kids at home are tired. And what I'm going to say is that we're moving into the holiday season, and really one of the most important things about this time of year is it's all about hope. And now we don't have to be wishful about it. The vaccines have arrived. They're here. And we're going to make sure, working in partnership with the private sector hospitals, that everybody in our community has access to these vaccines, and we're getting them out as quickly as possible. I have confidence in our team, and more importantly, I have confidence in all of us that we can do more to make sure that less people get sick, that we have less people in the hospital, and that as a community, we're making sure that we get everybody across the finish line. That's what our goal is as a community, everybody across the finish line. So, my message is, I know it's annoying to wear your masks and people are tired of socially distancing. You should never be tired of washing your hands, by the way. But this is a time for us to continue to double down. We can see our way out. By working together, we're going to get there together. Thank you. I get to introduce my new colleague, I almost said Assembly Member Otto Lee, but Supervisor Otto Lee.
Thank you, Madam President. Good morning, everybody. My name is Otto Lee. I'm honored to be speaking with you today. Today is a really, really exciting day for Santa Clara County. The long-awaited vaccines are finally here. And we are able to receive them on Tuesday, and we are redistributing it last few days. Today is the day we'll be distributing to many of the staff working in the frontline heroes at the skilled nursing facilities, and many more. We are expecting another dose of vaccine coming to our county again in about another 10 days or so. And as soon as they get here, we'll be distributing as soon as we can, because they need to be in our community as soon as possible. And I'm gonna say that we really get to finally see the light at the end of the tunnel. But this is also not the time to let our guests off the gas pedal, our feet off the gas pedal, because the numbers on our ICU bed capacity is still very, very low. With only about 40 ICU beds available. The message to people is that our hospital is full. Please stay home and stay safe with your family. For this coming holiday season, I urge everybody to spend time with your family, but also use technology like Zoom and other ways so that you could actually see your family elsewhere, but not traveling to meet them in person. This is the way we could fight this, and we are actually winning this. Once we get the vaccine out there, and hopefully we'll get herd immunity in a few months, we'll be able to come back out and get our freedom back. Mask is extremely important. Some people felt that the mask is restricting our freedom, but actually the message is exactly the opposite. Wearing masks would actually help us gain our freedom back. When the numbers goes down, we could go back out eventually. Once we're able to open up our community, we don't want to ever have to go back to lockdown again. And we can see this happening. So please, few more weeks, few more months of this, I think we could beat this. And so the message for everybody is, keep up the good work. We're almost there. Thank you very much.
Sorry. We'll now get the question and answer session of everything. We will call on everyone individually, and we will start with ABC, and if you can identify who your question is for when you ask. Thank you.
Thank you. So the question was regarding reports that there are additional doses in the Pfizer vaccine vials. I've only heard that on the news as you have. I think that that would mean that we have actually received more doses than we were aware of. Here at the fairgrounds, we're vaccinating as quickly as we can. The limit is, of course, the number of vaccinators and the number of appointments that we have. But certainly having more doses than we anticipated is good news.
NBC?
Yeah. I can't explain. Thank you for the question. The question is regarding the order of skilled nursing facility staff and hospital healthcare personnel. So they're all priority. It just has to do with the way the vaccine is shipped. So the vaccine gets shipped directly to the hospitals, and for whatever shipping reason, they didn't receive it on the same day that we received it, right? So it just has to do with shipping, not with priorities. So I don't have a timeline for you, but what I can tell you is that the ACIP, the Federal Advisory Committee on Immunization Practices, they're meeting this weekend to define Group 1B. So right now we know Group 1A, that's healthcare personnel, and then the state has defined the priorities within healthcare personnel. So this weekend, the Federal Advisory Committee will be talking about the next group and what that looks like, and then the next group, and we'll follow along. So it's difficult to have a timeline, but we hope it goes as quickly as possible.
Go to the Mercury News.
Yeah, I'll just lead it with Mercury News. How many doses of the actual vaccine do we have right now, and how are you going to calculate
I'm going to turn it over to Dr. Fenstersheim because I cannot keep the doses straight in my head and I don't have it written down. So one sec.
Oh, okay. I'm sorry, there's so much traffic noise back there, I couldn't hear the question. Right. So the vaccine is coming on a regular basis, and by the end of next week, we should have 68,000 doses of vaccine in our county, which would represent the first allocation of Pfizer this week, the second allocation of Pfizer next week, and the first allocation of Moderna vaccine, pending the approval of the vaccine. That has not been approved yet, and until it's approved, we're basically working with our Pfizer. But we expect the Moderna to arrive next week also. Yeah, well, there will be hopefully more manufacturers getting their vaccines approved into January, and then we will continue to get vaccine. Remember, this is a 2-dose vaccine. So all of the vaccine right now that we're getting, we are being told to just use it as a first dose. We are not holding any vaccine back for a second dose. So additional vaccine, though, within the next 3 and 4 weeks has to come for the second dose for everybody also. So we have to bring everyone back. Well, our message has been very clear. This is the beginning, hopefully, of the end, but it's certainly just the beginning. And so even though some people are getting vaccinated, it's going to take several months, and we have to keep telling and explaining to the community that we have to be vigilant, and so that we're all healthy and here for the vaccine. But we don't want anyone to be lax at this point. And hopefully the message is very clear. It's going to take several months, so don't take off your mask and stay socially distanced.
ABC.
Yes, right now, so right now we just have the public health department doing a small portion of it, all the hospitals, and then eventually as more and more vaccine comes, we will be bringing on many, many more providers. The community clinics within Santa Clara County and all of the other providers will eventually get vaccine to vaccinate the public per the prioritization schedule that's being set by the federal government. I can't look my crystal ball isn't working today, so I don't know, but it just depends on a lot of things. We hope that everything rolls out smoothly. There are several more vaccine manufacturers in the pipeline, so there's all of those unknowns at this point, but I'm hopeful, I'm hopeful by the middle of next year, probably. Well, again, we want to make sure that the science is brought forth and we explain what the manufacturers and all of the studies have and the trials have shown us. Also, we want certainly people to see that the medical community is stepping up and getting their vaccination, so we trust fully in the science of this and the safety of this vaccine. So there will always be people that are still questioning it, but hopefully over time they will see that it is safe and that everybody else is getting it. I'm sorry, there was so much noise. So there's a process. The vaccinations, all of the vaccinations, of course, are prioritized at the federal government. The state then is given their allocation from the federal government, and then the state then gives each of the counties their vaccination. We then work, and I didn't mention this before, but we then work with our provider task force, which is all the hospitals and providers, give them the up-to-date information and give the vaccine according to the needs that each provider have. And then we also have a task force that's made up of community members to make sure that we do this equitably and have plenty of community input in the process of us vaccinating our community. Yeah, it's not a matter of shipping. Everybody is basically focused on the first prioritization. So we have a lot of healthcare workers to vaccinate first, and we have a lot of residents of skilled nursing. So we are doing the skilled nursing because they are very small entities and they can't basically accept the vaccine as it's being shipped. The minimum doses are very large, and so right now the hospitals are getting their doses. We are taking the doses for the skilled nursing, and everybody is giving the vaccine at the same time. So we are just taking on this one segment of the population. The hospitals will take on vaccinating all of their staff. And again, we have about 130,000 frontline hospital and clinical workers in this community that are called healthcare workers, and that's who has to be vaccinated first. It's 130,000.
We'll go final question with Mercury News. Good? All right. Thank you, Dr. Fenstersheim.
Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.